What is catheterization for urinary retention? Have you ever wondered what happens when someone cannot empty their bladder? This condition is known as urinary retention, and it can lead to discomfort and even serious health issues. Catheterization is a medical procedure designed to help with this problem. It involves using a thin, flexible tube called a catheter to drain urine from the bladder when a person cannot do so naturally. Urinary retention can occur for various reasons. Sometimes, it happens due to an obstruction in the bladder outlet, like an enlarged prostate or tumors. Other times, it may be linked to neurological conditions that affect bladder function or recovery after surgery. When the bladder cannot fully or partially empty, it can cause pain and increase the risk of complications like urinary tract infections or kidney damage. There are different types of catheterization methods used to relieving urinary retention. The most common is urethral catheterization, where a catheter is inserted through the urethra into the bladder. This can be done using indwelling catheters, also known as Foley catheters, which stay in place for a certain period and connect to a drainage bag. Alternatively, there is intermittent catheterization, where the catheter is inserted to drain the bladder and then removed. This process may be repeated several times a day by the patient or a caregiver. In some cases, when urethral catheterization is not possible or safe, a method called suprapubic catheterization may be used. This involves inserting the catheter directly into the bladder through a small incision in the lower abdomen. This approach can help reduce discomfort and lower the risk of infection over time. The goal of catheterization is to empty the bladder completely and promptly. This helps prevent complications such as bladder overdistension and urinary tract infections. It is essential to use sterile techniques and select the appropriate catheter size and type based on individual needs and anatomy. From the perspective of bladder health, catheterization is an important tool for managing urinary retention. Proper use of catheters can help maintain bladder function and prevent complications. However, it is crucial to manage catheterization carefully to minimize risks, such as urethral injury and infection. If you or someone you know is experiencing urinary retention, it is essential to consult a healthcare professional. They can help determine the best catheterization method and address any underlying causes. In some cases, patients may learn to self-catheterize for long-term management, focusing on hygiene and technique to reduce the risk of infection. In summary, catheterization for urinary retention is a medically established procedure that helps relieving the inability to empty the bladder. By inserting a tube to drain urine, healthcare providers can tailor methods to individual needs, supporting bladder health and preventing complications.